Thank you, everyone. My name is Michael Williams Owolabi, and thank you for attending this panel discussion on a very important issue, especially in Essex County, food insecurity. Um, the intention of this panel discussion is to enlighten people on an issue that to many people is like invisible. And this is the kind of issue that like you hear about, but you don't really know all that much about. So that's why you invited Dr. Nelson Aluya to speak with me too. I have a couple of questions laid out for him.
All right, it's a pleasure. Thank you.
You can introduce yourself first.
Well, my name is Nelson Aluya. I'm a physician. Born and raised in Nigeria, migrated here 20-something years ago, and I medicine and pediatrics trained. I've been a professor of medicine at Rutgers Medical School, a New Jersey Medical School, and then I became Chief Medical Officer for the Newark Community Health Centers, a Federal Health Qualified Center, as well as a CMO interim for St. James Health. So I've done all of those things, but at the end, I still call myself a medical advocate. I work and read and live for the health equity and justice for people of color in New Jersey and across the globe. My particular interest is in diabetes and sickle cell as well. So it's a pleasure to be here to discuss such a big and critical issue that I had to face and address as Chief Medical Officer. So it's a pleasure.
Thank you. Yeah. So my first question, many people in food insecure areas struggle with not only the availability of fresh food, nutritious food, but also with the ability to physically get to stores or markets. Many people live more than a mile from the local supermarkets or grocery stores or like open air markets. So how can improvements to transportation or infrastructure bridge the gap between those who have access to healthy food and those who don't?
Right. Well, that's a great question, but I'll tell you this. Let's take it this way. When you talk about food insecurity, why does food insecurity occur? There are a couple of reasons. And that brings to the fact when you talk about food deserts.
Yeah.
Food deserts is a result of food insecurity. And the USDA define food desert as people who live in an area that have no access to food or nutritional food. And that definition is based on the fact that in the urban area, you may have up to 30% of the individual in that urban area living more than 1 mile away from nearest grocery, or a rural area more than 10 miles, or in any particular area, people who live in those areas have 80% less of household income as compared to the general population. So that's the definition of it. So one of the reasons is transportation, because again, from the definition, if you live 1 mile away for your nearest grocery store, then it becomes an issue. Where a lot of people who don't have access to transportation. For instance, in New Jersey, the network may not be that great. And even if the network is great, what's the average home income in those areas? I'll give you a typical example. In Newark, especially in which is Essex County, in the Ironbound area, where more of the Portuguese and all the other people live, the average income is about 34,000. You understand? And in Orange, it's about 18,000 per household. So you can imagine that with all the other things they have to think about, paying money for transport to go get food, it's a big issue. So, and that's very critical when you talk about, access to food and food insecurity.
Thank you. Thank you for that answer. Next question I have for you. Food insecurity often feels invisible to those living in wealthier neighborhoods, like I said in my introduction. But their resources, if combusted, could be a huge impact. What strategies can be used to inspire people living in affluent communities to support local hunger relief efforts in other areas?
Yes. again, it's giving back, volunteership. So you could take it two ways. There's government responsibility, and then you have private responsibility. What would the government, what can the government do to help um, improve access to food? Um, there are mandates, meaning policies and procedures that can be put in place to ensure that adequate food nutritional sources are within 1 mile of every community. You understand? So they can encourage setting up grocery stores. We have a lot of them in the urban area. So you can give government subventions or grants to those who run those kind of institutions to open up stores in the areas where people have access to. That's one. Two, uh, you could also give grants to transportation companies because there are people who can do that. I mean, often enough during summer, or other times you see where they have mobile um, markets. So, and those are perishable food. So, if you give grants to those people, they'll be able to um, help reduce the cost on them to be able to take food to those areas. So that's a good one. One of the things I did as chief medical officer was got a grant for the federal government, and in all the centers, I had 7 centers of healthcare. So with that grant, it was called a Catalyst grant. So what we did, or what I did, was use that grant to create food markets in all of those health centers. So because one of the two things that people who have food insecurity see is one, health, and then food.